Welcome to our fifth and final edition of Palooza Tuesday, powered by Process Palooza. My name is Tracy O'Rourke, and I'll be your host for the session. I'm Chief Innovation Officer at GoLeanSixSigma.com and a Lean Six Sigma Green Belt instructor at UC San Diego Extension. So thanks for everyone that joined us for the past few weeks. And for those of you who are new, congratulations, you made it to our last Palooza Tuesday. Over 600 people registered for today. So very interested attendees in today's topic. So for the newbies, a brief intro to Palooza Tuesday. In normal times, UC San Diego hosts Process Palooza on campus. It's a day-long event packed with keynotes, workshops, and a process improvement competition that's really fun, all to celebrate continuous improvement. Unfortunately, as we all know, Process Palooza was scheduled back in March, but with the coronavirus outbreak, we quickly shifted gears to bring our content and panels online. And so that's where Palooza Tuesday was born. Oh no, what just happened? Oh, sorry, I'm still on. It looked like I had gotten off. So we have a quick poll that we want to do to consider our for the conference that's coming up in 2021. We want to know if you can attend. So can you tell us, yes, you can attend in person, or if you prefer to attend only virtual events, because actually some people really like the virtual events now. So go ahead and answer the poll, and we'll see what people are telling us about going to the live Process Palooza again. And again, just so you know, they have a lot of interactive breakout sessions during the real Process Palooza or the in-person Process Palooza. And there's lots of networking. You get to meet new people. There's a Lean Six Sigma race where competitors can race against the clock to improve a real process. And so it's a lot of fun. And they have, I think, $14,000 they had in raffle prizes one year. So it's a lot of fun, and you can win a lot of good stuff. So let's see what the poll says. All right, the poll is yes. 57% have said yes, they would attend in person. Woohoo! And a few, 43% said they actually prefer attending virtual events. So that is really good to know. Before I go any further, I want to give a quick shout out to the sponsor, Koali Build. And they provide powerful, interactive, secure, and mobile-friendly process flows, no programming needed, and that puts your Lean Six Sigma program into action. Okay, and one more thing before we get started, because I know you guys are really excited about today's panel, as am I. A little bit about logistics for today. So all the sessions are recorded and are in closed captioning and posted to the website at processpalooza.ucsd.edu. Q&A will be open the entire session. So if you go ahead, you can fire questions at any time, and we'll try to address them as best as we can during the session. But if we can't, we'll go ahead and post those in the recorded video later. So at the end, we're giving away a prize, so be sure to pay attention. It's a $500 voucher for a project management class or a Lean Six Sigma class at UC San Diego Extension. There are plenty of online classes online. So if you are somewhere in another country, because we actually had people from New Zealand attend one of these, you can use this anywhere in the country. So don't be afraid to participate in that question, but you have to listen very carefully. So let's go ahead and dive right in. Today's session is Return to Learn. And this is a campus-wide COVID-19 testing program initiative that may allow UC San Diego to resume in-person activities in the fall. So we're going to share a quick video to help you better understand this ambitious initiative. And then we'll go ahead and introduce Ahren and the panel. Let's go ahead and share that video.
The UC San Diego Return to Learn program is an effort to test all students, faculty, and staff in the UC San Diego community for the novel coronavirus which causes COVID-19. The effort begins this summer, where we will test approximately 5,000 resident students And the plan is to expand this in September, where we'll test the entire UC San Diego community every month. Our team is being led by Chip Schooley, an infectious disease physician who will oversee the testing component, Cheryl Anderson, a public health expert who will oversee the contact tracing component, and myself as an infectious disease epidemic modeler who will develop simulation models to help us understand how to best identify outbreaks and prevent their transmission. Together with a team of UC San Diego clinicians, public health experts, molecular biologists, infectious disease specialists, epidemiologists, and statisticians will work together to develop a comprehensive program in order to best detect outbreaks and prevent their transmission to the UC San Diego community. This summer, we will measure our success by our ability to provide simple and easily accessible testing to resident students. Looking forward into the future, our ultimate goal is to allow the resumption of campus activities so that we can do what we do best: teaching, research, and serving the community. We would like to, together with a team of UC San Diego experts, develop a program that's adaptive, that can continually change due to the changing epidemiological circumstances to help us understand how to best detect outbreaks and mitigate the risk of transmission on campus.
That is a great video. What a remarkable undertaking. And guess what? Natasha's on the panel today, so you're going to get to hear more from her as well. Allow me to introduce Ahren Crickard with UC San Diego Office of the Executive Vice Chancellor. Hi, Ahren. How are you today? She's going to go ahead and lead the discussion with the panelists. So Ahren, go ahead and take it away.
Great. Thanks so much, Tracy. I am Ahren Crickard. I work on strategic academic initiatives at the Office of the Executive Vice Chancellor at UC San Diego. We are so excited to have our esteemed panelists here with us today to discuss the Return to Learn program. First, we have Bob Neuhard, Executive Director of Operational Strategic Initiatives, or OSI, at UC San Diego. Bob will be joined by Dr. Natasha Martin, Associate Professor in the Department of Medicine at UC San Diego Health. Also on the panel, Brett Pollak, Director of Workplace Technology Services at UC San Diego. And last but not least, Dean Pham, Director of Ambulatory Electronic Medical Records at UC San Diego Health. So let's dive right in. Natasha, can you tell us how this journey began?
Thanks, Ahren. So the journey for me began in March. I'm an infectious disease modeler, and I develop simulation models of disease epidemics. And one of the things we were trying to do was help the health system, as well as UC San Diego Health specifically, try to forecast their hospital resource need. So as I was developing simulation models to predict the COVID epidemic and the number of hospital beds and intensive care beds that might be needed over the next few months, I was working in close concert with Chip Schooley, a virologist and professor here in the Department of Medicine. And on April 13th, about a month into our stay-at-home orders here in San Diego, Chip came to me and said, let's start brainstorming about how we might be able to bring the campus back in the fall in the safest way possible. At that time on April 13th, in San Diego, there were over 1,800 cases of COVID, 156 individuals had gone in intensive care, and 47 deaths. So we knew that this was a serious situation, and we wanted to think about knowing that the campus is not an isolated community, and we would likely have viral introduction if some amount of instruction and campus activities were to happen in the fall. What kind of system in place could we put in that would help best detect outbreaks and mitigate the risk of transmission? Bob, do you want to talk about what was going on the campus that time?
Yeah, sure. So we also were doing a major transition at that time, trying to recalibrate our operations, our housing, our student health services. Everyone had to kind of rethink what they were doing and how they were doing it. From a housing perspective, we were having many students opt out of their contracts, and we were trying to facilitate that process. Our housing and dining organization was. From student health services, they had to come up with their models for how they were going to deal with asymptomatic students and then make sure that they could take care of them throughout the process. So there was a lot of work that was totally unrelated to what we normally do in our day-to-day work. And it was all focused really on more responsive, and it wasn't yet turning into kind of this proactive, what could we do next? We were really just trying to find a stable, normal, or not really normal, but a stable position for ourselves as a university with our current population.
So I think with that as the context, we were thinking, okay, how can we develop a scenario plan for the fall in order to proactively manage in real time? How can we collect data so that we can understand what's going on with any viral transmission on campus and act accordingly? And we conceptualized that the plan would incorporate, elements of risk mitigation. So how can we reduce the risk of transmission on campus, both through obviously personal protection, wearing, sanitation, but also configurations. How do we configure housing or classroom sizes in order to reduce the risk of transmission? So risk mitigation was one component. Another component would be viral monitoring. So that would include symptomatic testing of individuals who naturally presented to health services, but also asymptomatic testing of individuals either before they develop symptoms or individuals who are totally asymptomatic. And that's really important because of the biology, because we know that many individuals are completely asymptomatic and could be transmissible. And we also know that even for those who develop symptoms, there's about a 2 to 3 day window where they're still infectious before they develop symptoms. So we knew that asymptomatic testing would be important in order to really monitor viral activity and transmission on campus. We were also thinking about other elements of risk mitigation, like wastewater testing and surface testing, so we can, track viral activity on campus. And then the third element, in addition to risk mitigation, viral monitoring, was the public health intervention piece. So contact tracing, isolation of cases, and isolation of contacts. And so with those three elements together, we developed a kind of general plan that we wanted to be adaptive. So we wanted the plan to continually take the information that we had and adapt and potentially change the strategy as we learned, as we went along, because there were still a lot of huge question marks in terms of where we might see viral introduction and how we might best respond if we were to see it. So when we were discussing these plans, we decided, okay, let's do some quantitative modeling to try to understand what would be the best approach for some of these activities. And one of the early models we put together was looking at that risk mitigation piece. So it actually was very tailored to the UCSD community in terms of housing, where students are located within rooms and how many roommates they had, how many students shared a bathroom, how many residences are on campus. And we also incorporated complexity in terms of classroom size distribution. So how, some classes have several hundred students, some are very small. And we use that very detailed model to understand the impact of things like reducing the maximum classroom size to 50 to 25 and how that would reduce transmission. And also how various housing configurations, like only allowing singles and doubles or only allowing singles, could help reduce transmission. And that was really helpful. But one of the key pieces was the second part that I mentioned about viral monitoring. We want to reduce the risk of transmission, but we also want to be able to detect outbreaks as soon as possible because we know that there will likely be viral introductions. And so we did a separate suite of modeling that showed that if we wanted to detect an outbreak before there were 10 detectable infections on campus, we would need to do asymptomatic testing for 75 to 100% of the UCSD population every month. Now, that testing alone wouldn't prevent an outbreak, but it would allow us to identify an outbreak at its earliest possible stage. And so we did the modeling, and actually that was, one of the first things that we realized was, okay, we need a huge amount of testing. UCSD is 65,000 individuals in terms of our students, faculty, and staff. So in order to detect outbreaks early, we may need to test at a very, very large volume per month. And that was really how it all began, conceptualizing what the testing requirements would be needed come the fall.
That's incredible. So we have all of this incredible data modeling. Bob, how did we get from the concept on April 13th, only a few short months ago, to the idea for the testing pilot? And I think we have a slide here to, and it's really incredible to show this timeline.
So Ahren, maybe I can jump in here before Bob shows the timeline to take you through what happened before this timeline.
Absolutely.
If that's okay. Okay, so if you remember, I said that Chip and I started talking about this on April 13th. That was when the seed of the idea started about, let's think about testing people. Let's think about risk mitigation. Let's think about contact tracing and how these things are going to work together. In 7 days in the first week, we had already run the quantitative models that indicated that we needed to test 75 to 100% of the population a month to detect the outbreaks early. So 7 days later, on April 20th, we presented that information to the chancellor, as well as other people leading the response at UCSD. And we said, okay, this is what the modeling is telling us. We think this approach is really important, but this is the level of testing that we're talking about. And, obviously cost was a huge concern in terms of the cost of the test. But one of the primary concerns was, do we even have the ability to test this many people per month? 65,000 individuals tested every month is over 2,000 tests a day. Do we have the ability to test 2,000 people a day? And so on that April 20th, 7 days after just the seed, it was the chancellor that said, we need a pilot. We need a pilot study, and we need to do this soon. And that's when he went to Bob. And then Bob, maybe you can talk about how that happened.
Right. So I first heard about the pilot on April 23rd, about the desire for a pilot. And that's when I attended my first meeting to kind of get briefed in. And I think I had my first meeting with my team to kind of say, hey, we might have this project that we're going to be working on the next day, on Friday, the 24th. So no one else in no operational area really had any idea that this was going to be an opportunity to work on. And there is no one area you go to when you're looking at something at this scale. I mean, when you heard Natasha describe what the scope was, this encompasses pretty much every facet of an operation across an entire university. It has to find alignment, and that also requires new ways of working, new ways of interacting, new types of technology, everything that you can imagine that has to come together. So what we did over the weekend was basically my team stepped back and said, okay, everything we heard on Thursday and Friday in these meetings kind of breaks down into what? And we broke it into these work streams of research testing, contact tracing, data science, the technology that we would need, the staffing to make it happen, sample management, project communications, legal, procurement, and overall project management. We broke it down into that. And so on Monday, the 27th, we kind of said, here's the 10 work streams that we've identified, and everything's going to fall within these one way or the other. And we did a typical RACI type diagram, said who was responsible, accountable, who had to be consulted and informed for each one of those areas. And we really went from that into sharing that back with the cabinet and other senior leaders and saying, this is what we're thinking. And you can see, and if really on the 27th, the May 11th date hadn't been solidified yet, but because we had put so much framing around those 10 work streams, I guess people believed we could do it in 2 weeks. And so at that meeting, it was brought forward that, well, let's launch on the 11th. And can you do that? And this is not one set of disciplines. This is, we talk about lean and agile and design thinking. All those things had to gel together in a 2-week time period to bring this together. And we'll talk about that, I think, in a little bit. But basically, it was the work we did over that weekend that made people understand that we had an idea of all the component parts that had to come together and the work that would probably need to occur to get there.
That's great. Thanks, Bob. So you brought us up to the point of where the idea for the testing pilot began. We're going to break here for a quick poll to our attendees, and we're going to ask them, have you discussed process improvement in response to the COVID-19 crisis? So have you discussed process improvement at your organization in response to the COVID-19 crisis? And I think here we see often process improvement in response to COVID-19's brought in when we're talking about budget and financial ramifications and challenges as a result of COVID-19. But here you're seeing process improvement live in action Bob, I think we speak quite a bit, and sometimes we tell stories from years ago, but here you're telling a story, you remember it like it was yesterday, and it actually was yesterday, right?
And it feels like years ago, but it was only yesterday.
Right. Maybe we can take a look at these results. All right, a lot of people talking about process improvement in response to COVID-19 crisis. Well, I know we're all anxious to get back and see what happens next in our journey here. So Natasha, after Bob has been having these discussions, how did you actually design the pilot?
So it was amazing to have Bob's involvement because we came in without wanting to over-engineer it. I think our guiding principle was, if we're going to test 2,000 people a day and potentially 65,000 students, faculty, and staff a month in the fall, then we need to have a process that's incredibly simple, that is easy for individuals to access, a testing process that is simple for those individuals to do themselves. We don't have the capacity, and we didn't want to have a process where healthcare workers were masked up and they were performing the tests and everyone was standing in line, potentially transmitting COVID to each other. We needed to be so easy that people would just drop by, self-swab themselves, drop it in a box, and that there would be some logistical process so that those samples would be transported to the lab. The lab would run them and then easily be able to quickly and easily report those results out back to the students, faculty, and staff. So when we came to Bob, we said, we need the process to be really simple, and we need it to be easy, and we need it to be streamlined so that we can get all of this, from sample collection to sample reporting done within 24 to 48 hours. And so basically simple and quick was what we conceptualized. And then it was really Bob's job to kind of take that. And of course, there were 1,000 moving pieces and logistical complexities in terms of, the process and what we actually did and the data streams to enact that. But that was the sort of underlying design that we had in our mind. The critical aspects, I would say, were in terms of the ideas that the students would be testing themselves. We hadn't really solidified in the very beginning what type of testing that would be, and where those tests would actually go to get processed and sent back. And fairly early on, we decided that it would be nasal testing, so mid-terminate nasal swabs, not all the way back in your head, but just kind of here in the nose, and students could swab themselves, and that those tests would be sent to a CLIA-certified lab on campus. And that would mean that those tests were medically certified and could be reported back immediately as sort of official test results. And I think that was a key element that wasn't decided at the outset, but was decided fairly early on, that sort of helped Bob's sort of process planning. But the last thing that I would emphasize is that we really wanted it to be adaptive. We knew that we didn't know all the answers. We were relying on Bob to, use his expertise in terms of logistical management and process management to optimize it. And we wanted to learn as we went. We wanted to adapt as we went along with the pilot to tweak things. And we want to do that now, and we want to do that in the fall. And so this idea of sort of, let's make it as simple and easy as possible, and let's make it adaptive as we learn. And the last thing is that we really needed a strong data sciences framework. This pilot, as I mentioned, is one piece of a multi-pronged component in terms of our approach to viral detection and reducing transmission on the campus. And we needed to have all of the data really well integrated, both so Bob's team could analyze it and figure out, the process improvements, but also so that we could move forward in the fall and collect all the information from, all of our monitoring and all of our different data pieces to bring this together as a whole package. So that's how it was conceptualized. Bob, then how did you take that and run with it, I guess?
Yeah, thanks, Natasha. So first when we heard about this, it was a fantastic, incredibly important project for the university. So it was energizing, exciting, and we actually had no idea how we could pull it off. But we knew that if we pulled the organizations together, that together we could do this. And so, we've at UCSD, we've done a tremendous amount of Lean Six Sigma continuous improvement type of training. We've had thousands of people with yellow belts and hundreds with green belts and black belts. And so we're used to thinking that using those skill sets to solve problems. We there's sometimes a misperception that it's only about cutting costs and making things efficient to the point of sometimes being ineffective. And that's not really how we use it on our campus. We really use it as an enabling tool to solve critical problems. And so we took parts of design thinking, and we took parts of agile, and we kind of threw it all together and said, we're going to have to really understand, if you take what Natasha said about understanding where the students are and meeting them kind of where they were at, which was, they have been told for 2 months, don't leave your dorm unless you have to. Don't use PPE if you don't need to, so stay inside. If you do go out, use it. Don't go and get a test unless you're symptomatic. So they've been hearing all of these things, and we had to figure out, okay, we need to come up with an approach that's easy for them, that's engaging for them, that integrates all these different organizations into a kind of a cohesive delivery of a solution that didn't exist. So that's where the kind of the agile design and design thinking kind of came in, was to kind of conceptualize what this would be, because there is no one organization that does this. And so we talked to our campus logistics. We brought in student health. We brought in IT on campus. We brought in IT from the health system side in the Calm Lab. The Calm Lab is our CLIA certified medical lab. And so we brought in different people from all these groups and more. I'm not saying all of them. There's just so many that we had to bring in. And we started to conceptualize what we could do and how we could get there. And we looked, and so we had leads for each one of those work streams. And we facilitated discussions inside of those. And so that's kind of our design thinking up front. What would it take? And so our lab, our Calm Lab, was really used to having certain types of things show up with a sticker on there with a certain way, but we knew that we couldn't set up clinical, like a clinic on campus for every one of the areas where we have all of our students. So we had to come up with a new way of thinking about how can we get a generic sample to be associated to a specific student and over. So you're going to hear some of that what we're talking about later, but that's where the agile and the continuous improvement kind of really, I say that they're kind of agile and lean are better together. They're kind of like, peanut butter cup there or something, chocolate and peanut butter. They really go well together, and we use them every day, every night. And we can kind of talk about that process a little bit, but so our team did.
I was going to say, so how did it turn out? How is this end-to-end process? What did it look like at the end?
Well,
Dean, you could
Dean, you want to talk about that?
tell us a little bit about that.
Yeah, I can definitely jump in there. So so when we designed this workflow, like Natasha and Bob said, right, we want to make it easy for the students, reduce as many barriers to testing as possible. We wanted a process that we could scale, right? We're doing something a little bit small in the summer. We're doing a giant scale in the fall, right? And then we also want to get the results back to the student quickly. So with that in mind, we knew that the kind of standard COVID collection process wasn't really going to work well, where a student would have to come to a clinic, they would need to get registered and scheduled, an order would need to be placed, a health professional would need to collect a sample. All that has a lot of overhead, takes a lot of students' time, and then also that would essentially be burning through a bunch of PPE, right? And I'm sure you read the news, PPE is like gold right now, right? So we wanted to develop a process that try to improve on that and reduce as many barriers as possible. So the workflow we ended up creating was the following. So one of the fortunate things was actually in the last fall, we were able to bring student health live on Epic, and actually a nod to the UCSD Health IT and the student health team for being the first UC campus to bring student health live on Epic. And as part of that project, we had to load every single student into Epic. And where that benefited us in this project is that we did not need to register anybody. Every student was already pre-registered. So that helped cut down one step there. The next thing is, we also decided we were not really billing for these labs to the students, so therefore we didn't have to schedule the students. Another step we're able to take out of the process. And then as for the order, what we ended up using in Epic is a tool called bulk ordering. So instead of placing 5,000 individual orders and someone would just get carpal tunnel, right? We essentially teed up and placed all 5,000 orders in a span of like 20, 30 minutes. And what we did for that is we got a list from housing to identify all students that were still on-campus housing students. We added them to what's called a patient list in Epic to kind of give us the population. And then we use that list as our order base. So we place an order for all those students. So that's what we ended up doing in Epic. And then as for the collection side, again, we talked about location, 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 right? We wanted to go where the student was rather than making the student come to us. So we ended up setting up collection stations near their dorms, near their apartments, or even in their dorms in their apartment buildings. And what we did was we created testing kits. So each kit had everything a student needed to use to collect a sample. And Brett's going to talk a little bit more in a few minutes about exactly how we use technology to really quickly, intuitively link the kit to the student for identification purposes. So without me verbalizing everything about the collection process, I want to tee up a short video that we created, both for marketing purposes and education purpose, of what the collection process looked like to the student.
So Dean, I want to throw in one thing. If people noticed that there were people in those rooms, but they were there to monitor and record everything that was going on so that we could then each night do an assessment and make improvements every night. So I just want to throw that in. If you saw people there, even like Natasha said, the goal was to have these, not have people there to do the process or help people through the process. We were definitely there to observe and report so that we could improve the process. So thanks.
Exactly. And so after the student would collect the sample, essentially the sample would go to the lab for processing, right? The lab would essentially label the specimen as needed, and the turnaround time that we advertised to the students was 24 to 48 hours from collection. I think the vast majority of students got their results the next day. So we just gave them that buffer. And then when the results became available, since we were using our Epic EMR that was in place, what we used was we were able to push the results directly to the student's MyChart account. It either came via a push notification on their mobile app, or came via an email saying that, hey, you have the results ready. And if the result was negative, the notification would be an instant push to the student. If the result was positive, it would actually wait for a physician to review it, and the physician would manually push that result to the student. So I'm going to jump into the second TikTok video that you saw, which kind of shows from a student's perspective what the result looks like.
Waiting for you to call, but you don't answer me anymore. So tell me now, what did I do? There is no need for trouble inside you. Staying up way too late, thinking that there is no other way. I'm giving up, letting it go. You're like a ghost, but I ain't afraid. No, don't be scared.
So I think at a high level, that was essentially our end-to-end workflow, from all the way from what we did in Epic to the collection to the lab and then the result process. I would like to pass it over to Brett so he can dive in a little bit more detail about the technology that we use in the collection and lab workflows.
And thanks a lot, Dean. The TikToks were pretty innovative. Actually, that last one was made by one of the students that participated in the program. So definitely look to them to kind of crowdsource the marketing efforts on this and figure out kind of what was resonating with them. In terms of the marketing outreach in the program, that was led by Lisa Joyner and members of the OSI group. They did a great job in really understanding, what was resonating with the students and what was not. And the message evolved over weeks. So we tried to hit that, 75% minimum threshold of the students that were currently on campus to try to get them in to, to get free COVID testing. And it started out just with that kind of message, right? Free COVID testing. But then we added different carrots and we kind of tweaked the message and different messaging channels like TikTok and some of the other social media platforms that the students were on. But at the end of the day, the messaging that really resonated the most with the students was around kind of the greater good. So based on our survey feedback that we were getting from the students, the message that resonated with them the most was, come get screened for COVID so that we can begin opening up the campus in the fall, which was really interesting. So that kind of 360 feedback that Bob and Natasha were talking about was definitely utilized throughout, the days and the weeks and the evenings to figure out how we can kind of, tweak the messaging and tweak the process. As Dean pointed out earlier, the framework that we were using for testing the students was entirely new to everyone. We had to be real creative in our thinking, and in order really to get the type of participation we were looking for, the design of the program was critical to getting buy-in from the students to participate. And this pertained, to everything from the messaging and the outreach on the students, and as Dean said, the geography and the testing locations had to be where the students were living on the campus. So it was very distributed and dispersed amongst the different campus neighborhoods. And we knew the tests were going to be self-administered. And as you saw from the video, it wasn't the most comfortable thing to administer, to self-administer. So we had to find a way really, in addition to that, to link the test kits to the students. Knowing we had a pretty relatively high adoption rate of the UC San Diego mobile app, we thought, what if we could pre-label the test kits with a unique code and then embed the scanning technology into the UCSD app that the students, predominantly already had installed on their mobile devices. Then if the students are logged into the app, we know who they are, and then the QR scanner could be used to associate the student with that test kit. So that's exactly what we did. So beginning over the weekend of April 25th, Alex Wu and a few others on my team began the development. It was really hackathon style, had all hands on deck really to contribute to the code base there. And in just a few days, we had a working prototype, and we just kept refining from there. So kudos to that group really for just jumping on board and getting with it. We had Stacy and her team in the student health organization. They assembled the test kits in mass, and each one was pre-labeled with a QR code that we produced for them. And then we had to right size the labels and look at printers and things like that, getting everything that we needed really to do this mass assembly. And it was amazing, all of the volunteers that came together really to help with that. And then from the lab point of view, we knew the testing bottleneck was going to have to be shouldered by them. Natasha and Chip and others, they really felt strongly that we needed to move the bottleneck as far away from the students as possible. And then we can focus on streamlining the steps in the bottleneck really to just reduce that whole turnaround time that we had from the end to end. So from when the students administered the test to when they got the results, we wanted to try to minimize that window. We were advertising, 24 to 48 hour turnaround. And so we wanted to try to, get those results to them as quickly as we could. So an example of what we did on the lab side was examining that lab workflow for processing the test. So what we did was we developed an iPad app that was installed at the lab. The lab used that iPad app as kind of a reader, right? So as the students scanned a QR code on a test kit, that test kit made it back to the lab. The lab then would scan that test kit with the iPad and it would pull up information about the student. And at the outset, the technicians saw that the patient info on the iPad had to be manually then input into the lab software. So we came up with the idea to translate that test order number that was associated with that particular student into a barcode. And we just did that on the fly. And this was a process improvement suggestion that we made, late one evening, and had that really available in the next day or so. So the lab technician really could scan the iPad for the test information and have that automatically populate in the lab system. So that step reduced the chance of errors on the lab side. It also saved time, and really those few seconds kind of, if you look at it as an overall cycle with all of the, the test kits that were being, processed at the lab, it really added up in the end in reducing that kind of time to delivery on the test results for the students.
Well, this is incredible, Brett. Thanks so much for talking to us about that. I love the way you guys capture the voice of the customer, which in this case is the student, and that's part of our Lean Six Sigma methodology, which is a continuous improvement methodology we use here at UC San Diego. We're going to take a break for another quick poll. For our attendees, the poll question is crisis management part of your job description? Is crisis management part of your job description? And as we wait for everyone to answer, Bob, I wanted to kick it to you to talk about this a little bit. Was crisis management in a lot of the team members' job descriptions here? Oh, you're muted.
Probably better if I'm muted. But I don't think it was really in anyone's job descriptions, especially at this in this type of a model or approach. I think that we are all, when you look at the role that Natasha and our health system play in our student health, they're prepared for crisis in many ways, but to operationalize that response is something that we hadn't really. We do different types of emergency response testing, but I don't think we've ever tried to do an emergency response testing like in this type of a situation. And it really took, like I mentioned earlier, it took a combination of skills and capabilities of everyone bringing them to the table. But it really took, I think, at the core, a lot of trust for everyone to trust that, that everyone believed in the outcome, the goal that we were trying to achieve. And it took trust in each other that we are all going to bring that next iteration, that next idea to the table, and that all ideas were valued during the process. So we really had to really believe in each other. And I think we did that. We can't say enough about the folks at Student Health and all the work they did on this and what they were doing on the ground throughout all of this. They didn't know us at all when we started this project. And they went out to these locations, they mapped all this data, they collected all this information for us, and they trusted that we were going to do something with it. And I think that they saw that we really took it seriously and that we wanted to. And I think that it built synergy across the entire paradigm, and Brett's group iterating every night, Dean working with the lab and bringing that feedback directly to us into these late night meetings, and everything changing. It wasn't, crisis management wasn't part of what we do as our day, but this crisis brought together a whole new paradigm in how we work together. And I think it was the trust that we built early on that really helped us deliver the project.
And Bob, I love what you told me about the student health workers who are actually students working in those testing centers, and what they had to say about the feedback loop.
Well,
it felt like their feedback was being
heard. And there were staff and students out there throughout this thing, but we had a tremendous number of student health staff that were actually hearing it for seeing people really care about what was happening. And I think that really did was very powerful in the whole process. What was that result there? 70?
Yeah, let's look at the results from the poll. If you could pop those up once again. So crisis management, not really in everyone's job description. And as you can see with this team here, not really. It was 22% yes, 78% no. And as you can see from this team, crisis management, not exactly in everyone's jobs description, but everyone jumped in to help out. So where do we go from here? What are the plans moving forward? For example, will the teams be formalized?
Well, some aspects of it probably will be formalized. I think formalized is maybe too strong of a word in many cases. This is agile and adaptive, like Natasha said at the very beginning. So I think from my perspective, we're identifying all the work streams that we need to get to fall. We're taking all the learnings that we have from this process that ended on May 29th, and we have to be willing to, celebrate the success of it, but at the same time, be willing to really change what we've done. So maybe, we had walk-up locations where people grabbed the thing, did a test in a open sort of environment where they could, maybe that's not what we want in the fall. Maybe we want to get these directly to the student's dorm room in the fall. So there's different things that we're going to test over the summer, and we're going to try it with some different cohorts over the summer. And I think those are things that we have to really, we can't be too proud of what we've done. I think that's where we could get ourselves in a bad spot. And I think this team that came together on this, as we reorganize and realign around these next set of things we have to achieve for fall, none of us are going to fall into that trap because of the process we had, where we challenged ourselves every day and every night to find out, and really took it from the perspective of the customer, who is the student on this. And this, as we go to the fall, it's the students, the faculty, and the staff. And how do we make the campus as safe as we possibly can for people returning in the fall?
Perfect. Natasha, can you tell us a little bit about the modeling and where that goes from here?
Yeah, sure. I mean, we have just a number of pieces that we're trying to integrate with the modeling. As I mentioned, the testing component is only one part of that. And, we're continuing to innovate in that area. One of the major sort of feedback that we got from the students is that they would prefer to have a saliva test. So there's, lab validation going on. Bob is overseeing all of these pilots in terms of other populations that are on campus to try to, really take this to scale in the fall. But aside from that whole testing piece, which we've been talking about, as I mentioned earlier, we have other things we're thinking about in terms of how can we detect early using environmental monitoring of wastewater and sewage, testing of surfaces, or even air, testing the air. And so we have an environmental monitoring kind of group that's analyzing that, and we're thinking about how we can use that information and feed it into the models in real time to try to better target our testing. For example, if we can detect outbreaks or detect viral activity in the wastewater in advance of our asymptomatic testing, then maybe we can do wastewater testing in dorms, and then when we detect a signal there, we can go into that dorm and do widespread testing to really find the cases, right? So we need a methodological, quantitative framework to bring all these pieces together and bring all of the data together to inform our response. So we have the environmental monitoring piece. We'll also be doing molecular sequencing of any of the cases that we find to see how the cases may be linked and to try to understand growing clusters and transmission clusters. That data will also be integrated into the modeling to understand how to reduce transmission. One of the key questions that we have in terms of how to reduce the risk of transmission on campus is trying to understand the actual contact networks of students, faculty, and staff on campus. We have, for example, staff that have very different jobs and they have very different contact with other individuals. Some staff members work in housing and dining, and so they're in contact with a large number of students and faculty and staff per day, and others, are more located in their own office and don't have as much contact. So understanding the heterogeneity in that, both among our staff and faculty, as well as our students, in terms of how they're coming into contact, where they're coming into contact, will really help with that. So we have an entire arm that's looking at potential technologies for understanding that, either through geolocation monitoring, so monitoring GPS on your cell phone data that tells us where people are and where they're located, or something slightly different like Bluetooth bumps, which they don't actually track your location, but they may track if you've come within 6 feet of another person. And those are helpful for both exposure and notification. So if you've been in contact in the last few days with somebody who is later diagnosed with COVID, it can send a message to you to say, you came within 6 feet of somebody who's now infected, please monitor your own symptoms or seek testing. But they can also help us understand, again, how people are coming into contact with each other. And that's so important for understanding how we might be able to reduce risk on campus. And also important for us in helping us understand how people are or are not adhering to the social distancing recommendations and guidelines. Because I think the whole idea is that we want to have a data-driven and rational response to this. So unfortunately, unfortunately, we just haven't had enough information to understand exactly what our ideal strategy would be. And we've had a very sort of binary response: close things down or open things up and just allow it. And what we wanted to do was take a more sophisticated angle. So if we have a very sophisticated simulation model of transmission on campus and how people are coming into contact with each other and how they are adhering to social distancing in some ways or perhaps not, then we can make more evidence-based and sort of nuanced decisions about where we need to restrict activity if we see outbreaks. Maybe if we start seeing viral introductions more among the graduates versus the undergraduates, we'll take a different approach. Maybe we don't need to close the gyms because we don't see people coming into contact there. So I think the idea is we'll take the data as we go, we'll incorporate it into these models to understand how we can best detect outbreaks and reduce risk of transmission, and develop a strategy that in real time can help us make these more nuanced decisions so it's not such a binary decision.
Thank you, Natasha. And I did have one follow-up question there. What's it been like for you as a researcher, as faculty, to see the adaptive design process in action?
You know, it's been amazing. I've been completely blown away. I mean, the time scale, as you've seen, was incredibly condensed for this. So there was, as Bob mentioned, we had, nightly meetings. Bob and I are on the phone until 7 p.m. after their final meeting, and he was working until the late hours, refining and iterating, and that's amazing. And the other thing that was amazing in terms of the iterative adaptive process was the multidisciplinary team we had. We had so many people involved that came from so many different backgrounds that it enabled us to really be adaptive, because we had all the sort of perspectives that we needed. We had all the expertise that we needed in terms of, for this pilot, the labs and the IT processes and the privacy officers, and it just basically so much of that. And that framework in terms of hearing everyone's voice, getting everyone's expertise, and making sure that all fed into the iteration is something that we want to maintain sort of moving forward in the broader program. Because, this project, as you've seen, was so complex, involved so many, linking so many different people together to get something that actually, did end up being incredibly simple. It was 5 to 7 minutes. Students came in, 5 minutes later, they were tested. 24 to 48 hours, they received the results on their phone. The TikTok videos make it look so easy. What Bob's team did was a logistical nightmare. But it was, so it was incredible that we had all the input that was able to, from all the different players and stakeholders to make it kind of come together in that streamlined product.
That's incredible. I'm gonna go through our panelists and ask her the same question. Brett, for you to see that, I love the idea of this weekend hackathon, and I also love the idea of the open Zoom channel all day in case students had problems with the app and the QR code. What was it like to see that agile design and iterative design process in action?
Yeah, no, that's a great point. One of the things we realized too was when you introduce IT into any situation, especially one that hasn't been time tested, you're bound to see errors, right? Or you're seeing issues. So one of the things we did, as you mentioned, from an IT support side, was we deployed laptops at each of the different testing sites, running a continuous Zoom session. So if students had any type of IT issue with the app or their phone, they could walk up to the computer and then we'd be able to troubleshoot with them remotely. And we logged, I think, somewhere over 70 cases, something like that. So nearly all the cases were resolved within the matter of seconds to minutes. Common issues were things like network connectivity, logging into the app, some nuances with the phone. But it's funny, as the days went on, the medical staff at the sites did an amazing job of transforming themselves into frontline IT support agents, and they were handling a lot of the common issues that we saw. So IT really never had to step in to get involved, as we're kind of going through the weeks. So, granted, this mobile-based kind of support, mechanism works so well. We've been thinking about how we might be able to deploy kind of this virtual agent format, in the service desk and other places for IT support, in different, spectrums across the campus outside of just this program. So it sparked a lot of good ideas, I think, for us.
That's incredible. Dean, I'm going to turn to you. So you were brought on maybe a week prior to launch and thrown into this and had to manage this adaptive iterative design cycle. I think you're never going to answer your phone again, right? You're not going to take that call again. But how was this experience for you?
Yeah, especially if it comes from Bob, I won't pick up those phone calls. But yeah, I think both Natasha and Bob mentioned, you know, the big pivot in the planning process was when we decided to use a CLIA lab, right? And when we decided to use the CLIA lab, essentially that meant we used a medical center lab to do the process. And that's when I got pulled in, which was about 6 days prior to the go live. And knowing that we had to essentially stand up a testing process for a couple thousand, you know, up to 5,000 students in 6 days, was definitely a big hurdle to overcome. And but to tell you the truth, on the health IT side, I think all the teams pulled together. We actually spun up twice-a-day meetings, 30 minutes in the morning, 30 minutes in the afternoon, to get constant updates on how we can do all the stuff that we talked about, how we can do bulk ordering, can we bypass registration, can we bypass scheduling, can we get the results back to the students in a timely manner. And you know, the team just actually jumped on it, right? I think a lot of what Brett mentioned, where the students wanted to do this because they wanted to reopen the campus in the fall. The same can actually be said for the staff, right? The staff saw this was a project that was just not like, hey, let's go test a bunch of students. They saw this as a project that was actually leading to something that would be essentially a greater good for the community, right? The campus community and student community and faculty and staff. So they all actually jumped on board. I think all of us had, to a certain extent, had fun doing this project. And it is actually very rewarding as well. And one of the things I do want to call out too is throughout the process, like Bob mentioned, we had staff on site observing, right? They were taking notes. How long did the students take to do process A to process B to process C? Where were they struggling? Where did we have bad instructions that we could refine our instructions? We actually reprinted and edited our instructions multiple times in the 3 weeks, right? We started with printed instructions. We started with a long list. We started with using A-frames and then just shortening it. We moved, ultimately we moved to this TikTok format because realistically, I mean, as you saw the video, it was like a 1.5 minute video. It gave a lot of information. It provided almost everything the student needed to do. And I think that iterative process was actually really great to see, and how quickly we can iterate to help, because otherwise we would have just stuck with, hey, here are the instructions. The instructions are right? But it wasn't exactly what worked for the audience or the customer. So I thought that was a real impressive thing that the team was able to do.
That's incredible, Dean. Bob, I want to turn to you and talk about this continuous improvement cycle and what it was like to be here in the control tower. One of the stories that I love was one of the nurses came out in the mornings and was asking students if they wanted to get COVID tested. She got lukewarm results. But after one of your check-in calls, and I think you had multiple check-in calls a day, she changed the narrative to say, are you interested in helping to see whether we can open campus back up in the fall? And that's when they really got a lot of response from students. So what was it like to be in the control tower, managing all of these rapid continuous improvement cycles?
For me, it was energizing, right? It was very energizing to be there. Of course, if you didn't have energy on this project, I don't know what would get you energized, because it's one of those projects that really is so meaningful and rewarding. But it was, you know, to lay out our days, you know, the student health services, so the campus logistics would deliver a number of things to the sites. It could be moving A-frames around or something, or supplies. The student health group would show up there. They'd set up the site, be ready for the day. Then about 2 hours in, there would be a touch base call. We collect information on that call to see how things were going, and start to think about, okay, what are we hearing? A couple hours after that, we do another touch base call out to every site, hear what was going on. And then at the end of the day, all the student health people that have been on site would do a report out on a call. And then we didn't even have a real name for our team. Kind of the working team would meet after that call, debrief on it, and take everything and think through what do we need to do to iterate for tomorrow. And to be clear, we started kind of with a min-specs concept at the launch, because in 2 weeks, you can't have all this dialed in, and we knew that. So we took that min-spec approach and then just kept improving over those 2 weeks. And everyone, and then after that, poor Chip, Natasha, and Cheryl had to meet with me and debrief with me. So that was our late call. And it wasn't like a cool thing like late night, like the late show or something. It was me, so it was too bad. But that process, these were incredibly rewarding days. So it was something that I think there was value in every session. It wasn't, there was laughter and other good things that were happening too. But it was great to be in that spot to see it and then try and help to just make sure I did enough, but stayed out of the way. I mean, really, there were great people using all these different skills to deliver everything. And it wasn't me directing, it was me just helping in different places to help clear the path where needed. And I think that's where you take some of the learnings from Lean Six Sigma and understand as a leader in that, you let the people go and do. And your role is to really just clear the roadblocks if there are any that are going to stop them from being successful. And I think really that's what happened in this case, is that I was just more like a little bit of a traffic cop in a bulldozer in some cases, and then the team was able to just go forward.
This whole story is just incredible. We are getting so many questions, and I think what we're going to do is invite our show host Tracy O'Rourke back to help. She and I are going to run through some of the questions from the attendees. And panelists, if you could stay here to help answer some of the questions, that'd be great. Tracy, do you have a first question for us?
Well, yes, of course I do. One of them is from Anna Lee. And of course, this is asking, what improvement did Lean Six Sigma bring to this deployment? I think you talked a lot about it, but she had a second question, which I thought was really important. Was there something you would have overlooked had you not approached this from a Lean Six Sigma standpoint? Who wants to take that one?
I think we can all probably weigh in on it, but I think we would have, we never, I mean, if we hadn't started with the voice of the customer and really started with that premise about what would work on that front end to make this seamless experience that we were trying to achieve, it could have been very, very different. Dean mentioned the bottleneck. There was actually a literal discussion of where do we want to put the bottleneck, right? There was a discussion on that because this is so tight of a time frame that we knew on day one there was going to be one, because there were just too many parts. So I mean, if you think about how you apply that and said, okay, the people we need to, the only way we can prove that we can scale this in the fall is to get the students in here, then we need to choose them and then move that there. So I mean, that was a very basic premise, right? But really looking at that value stream and saying, where is the value stream part of this? And that's where the value had to be at the very front.
Mm-hmm.
That's incredible. I was going to tag on to that with a question. How did you come up with a plan to distribute and retrieve the test samples from students? And this one says students, faculty, and staff. This cohort to which they're referring was only students, residential students, but while adhering to COVID-19 social distancing guidelines. Can you talk a little bit about that?
Yeah, I can jump in on that one. So that was that fit along what we were trying to plan, right? Where if you imagine the testing site, it's actually very basic. Essentially, we had 2 tables. We had hand sanitizer and we had kits. So the students would show up, they would pick up a kit, and then they would get instructions on the A-frame, and they would essentially do their self-testing process. And once they finished, they just put a kit into the collection bin. So this whole process, what I just mentioned there, really did not involve any staff, right? The staff was really standing back, watching, observing, and recording for us so we can iterate and improve every day. But that was the process. So we really didn't have staff really interacting with the students other than saying, hey, thank you for coming, pick up a kit here, go to that table and collect. And then actually in between the collection, staff member would clean the table, right? Just so we would not have one student potentially infecting the next student by using the same table. So we did have that. So that's how we maintain social distancing. On some of our bigger locations, we did have a line, a queue that queued up. So for those, we did what a lot of like shopping centers do now. We put a little tape on the ground showing, hey, here's where you should be standing. But I think by now it's almost sadly second nature that when you see a line, you just don't stand right next to the person in front of you. So that's kind of what we did to try to maintain social distancing between the students and the staff as well.
Very good. Thank you. Very helpful. What happens when someone does test positive for COVID? What is the plan for them to not infect others and get healthy? I'm sure you talked about that piece of it as well. Who wants to take that?
I'll take that. That's a great question. It's so important because it's sort of the third pillar of the response: viral monitoring, reduction of viral transmission, and then this public health response. So the public health response is being led by Professor Cheryl Anderson. She's the Dean of the School of Public Health here at UC San Diego. And that will incorporate the traditional public health activities of notification of contact. So notification of the case. The case will be told that they are infected. If they're an on-campus student, they'll be provided isolation housing, so a separate room if they don't have a single and they need to isolate. They'll be provided isolation housing. There are over 330 beds being set aside for that at the right now, as I am aware of, in the fall. So those students will be isolated. They'll be brought meals during the day. Anything that they need will be brought to them, so they'll be able to isolate for the full 2 weeks. In addition to that, there'll be contact tracing activities. So Cheryl will then oversee a team that will contact those individuals, ask them about who they have been in close contact with in the previous time period to understand who they might have transmitted it to. Those contacts will then be notified, and they will also be provided isolation housing, even if they're asymptomatic. And that's a critical piece because individuals can be transmissible even if they're asymptomatic. So that quarantine part is really important. For off-campus students, they'll also be offered housing through local hotels where they have discounted rates that they've negotiated, so they can also isolate if they need to from any members of their household, and the same will be provided to staff and faculty if they need to isolate outside of their own home. I think the critical part is that we need for that process to be incredibly comprehensive and people to be willing to participate in it so that they don't transmit it to other individuals. One of the things we learned in the pilot was that students were concerned about testing positive because they didn't want to be isolated. They didn't want their contacts, if they were positive, to have to go through isolation. This is a real concern, and obviously it's no fun for anyone to have to be isolated, even if it is provided by the university. But one of the things we're trying to emphasize is what's worse is having to maybe, having outbreak that occurs that's very large because students or faculty or staff are unwilling to get tested, and then we have to close the campus down. So we need to think about the messaging and trying to understand, again, going back to this idea that this is a collective effort. The testing needs to be normalized and that we all need to participate in this collective community effort to keep our campus safe.
Natasha, I just had one follow-up question. It was in the Q&A as well. And you did address it. It was about students that don't want to test, right? So you're saying it sounds like it is optional, and you're really encouraging people to do it for the greater good and for themselves and for others. Can you tell us a little bit more about that?
Absolutely. And I think there were a few questions that were asking about things like privacy and what happens. And those were all concerns that we heard from the students. The students were concerned about the privacy of their data, what would happen. Again, this pilot was actually not a research activity. It was a public health intervention. And the tests, because of the EPIC linkage, actually went directly into their medical records. So that was, all the information was held within the EPIC database in their own medical records, and they could access that themselves. So all of that was protected under standard regular HIPAA guidelines. And there were concerns about that. And there were certainly individuals that were reluctant to be tested for other reasons. There were many students who were reluctant because, again, they were worried about isolation, or international students were worried about what would happen to them. Would they have to go home? So all of this is something that we need to address in the fall to kind of ensure that we can get participation. It is voluntary. It's not a mandatory program. It's voluntary, and we want to have high participation. Now, having said that, the modeling doesn't show that everything falls apart if you don't reach 100% participation. I mean, of course, course, the less participation we get, the less we're able to detect outbreaks at that very early stage. But we still do a lot better than just waiting for students to walk into health services, or faculty or staff to just walk into health services with symptoms asking for testing. So I think the general approach of just trying to get this widespread message out, trying to get as many people tested as possible will help us and enable us to do a better job detecting outbreaks.
Thank you so much, Natasha. Ahren, did you have a question that you wanted to ask?
Well, I was going to kick it to Dean. Dean, did you want to chime in on the reporting dashboard?
Yeah, I certainly can. So just to add on to what Natasha said about HIPAA and privacy, right? Really, the student's result, right, was really only available between the student and the physician. Those were really the only two people that saw that individual result. So that's how we, and that really just kind of follows the normal HIPAA guidelines of within EPIC, right? And from a research perspective, or sorry, not from research, but from a reporting perspective, we had our analytics team run daily dashboards. That was actually automated email to all the team members every morning to show, how many tests were resulted yesterday, percentage positive, percentage negative, and had a running total and everything like that, which really helped us identify which cohorts were positive and negative, and how we needed to react, and how we potentially needed to also change our marketing to get different groups of people more excited to come test, or actually even shift our locations as well using some of that reporting.
Well, that's incredible. Thank you so much for answering that question. I did want to address the test. We had some questions about the nasal swab. I've had one of those. When I watched that TikTok, I cringe a little. Talk to us about how you decided upon the test, and Bob, you sort of alluded to the fact that might change for the fall.
Yeah, I can probably start with that. So I think the first thing I saw on the test was we did not do a nasal pharyngeal test, right? The nasal pharyngeal test is essentially sticking a swab up your nose and like tickling the back of your eyeball for that. And that's not something we would have a student do themselves. That's not anything we would have any one of us do ourselves, because it's actually just really tough to do. So what we did was a mid-turbine test, which was Natasha mentioned, where you just go about to here in your nose to swab. And there's actually a number of different studies that's actually had self-administered tests using that method. So that's a method we did. But even with that method, it's not the most comfortable method. Where it's uncomfortable. It does cause a reaction where the student could want to sneeze and things like that, which can lead to potential spread as well, which is why Bob talked about really where we want to move towards is something even simpler with a saliva test. So Bob, do you want to talk about that piece?
Well, right now the saliva test is something that is in validation. We're going through it with our labs right now, and we're hoping that we're a couple of weeks away. We just need to have enough people that have the active virus that they can do it, and Sasha can probably talk about better than me, but where they can actually do the comparison to between the two different types of swabs and go through that process and look at the differential and sensitivity. So that's underway. We think we're a few weeks away from that. And so we're hoping to, in some of our other cohort tests that we do this summer, try that and see how that works and how that is received as we go forward.
Bob, can you tell us the results too of the 1,500 students tested?
Yeah, so we had 0 positive results, which was fantastic. We had 1,483 that actually went all the way through the system. We did have some people that came in twice. We did have some other people that tried to sneak in, and so we took those out. In total, we had 1,578 people that actually did self-administer a test. But a number of those, like about 95, were people that weren't supposed to be in there again, weren't supposed to have been in the process. But like we said, we tried to make the front end of the process very accessible. And so where we put our controls in place in that process, we're at the lab. So at the lab, it would be identified as a duplicate person that already came through 2 days earlier, or it was a staff member that came in or somebody else, and they were pulled out at that point. That way, again, we weren't slowing down the front end of the process. We weren't creating long queues. We were making that front end as seamless as possible.
Wonderful. Thank you, Bob. I got 2 questions from some folks that are very similar and interesting. So you guys have involved lots of people at UC San Diego, very admirable. We're getting questions already about scalability and bringing it to others. So smaller universities and scalability, is there any model that this type of model will be shared with either smaller universities or even county, state, or federal level responses? So obviously you guys are trying to stand this process up here at UC San Diego. But have you had any contact, or are there plans to contact others that are possibly going to be needing to scale this model out?
I'll take that one. Yeah, we've had an overwhelming amount of interest from other universities thinking about how they can adapt this program or use it where they are, both within the UC sort of schools broadly. Chip and I are on many committees now where they're thinking about how they can develop a testing approach across the UCs, but also across other institutions in the United States. I think the tricky thing is that it's going to have to be a campus-specific response for a few reasons. One, because every campus is different in terms of where they're located and the background epidemiology of the epidemic. What the strategy that a university might take in New York City is going to be different from what we're taking here in San Diego, just based on the background epidemiology. But then, of course, university campuses themselves differ so much in terms of their ability to do this widespread testing. We're fortunate at UC San Diego to have a medical school here. We had a lab that could do the testing for us on site. That enabled us to streamline this process. It's not something that would have been essential, but it also enabled us to reduce the cost of the testing, because we're not paying the sort of medically advertised cost for our tests. And cost is a huge barrier for other universities. So there were a few elements that we had here at UC San Diego that made this program uniquely able to be potentially delivered as we saw in the pilot, but then also scaled in the fall. And other institutions are just going to have to see whether they're able to put in these, adapt this model and do this level of testing with their resources and their medical kind of partnerships.
And Natasha, I was wondering if the other type of, we have thought about this as a research study up front, and there are campus research labs that many other universities may have that are using other technologies like CRISPR or other things that might be at a very low cost and high volume. It might be an option for some universities. You can maybe touch on that a little bit, because in that case, yes, maybe that student or faculty staff member might have to go through another test for a medical center, but that will at least help them detect the virus on their campus. Is that something you want to touch on?
Yeah, absolutely. Thanks. That's really important. I mean, I think that there are many groups that are looking at innovative testing methodologies. You mentioned CRISPR and LAM in terms of trying to reduce the costs and increase the volume and workflow capacity in terms of delivering this level of testing at scale. That's important for other institutions, but also UCSD. I mean, we're thinking about how we can innovate as well to reduce the costs, because there have been a few questions I saw in terms of who's going to pay for this. So the pilot was sort of paid for by the chancellor, and UCSD is going to pay for this in the fall. Now, part of that is because this is a huge research enterprise and teaching is a huge thing, and they really wanted to bring these things online, and we're willing to pay for what could be up to $2 million per month of testing alone. So it's a huge consideration. So we also need to be thinking about how we can utilize these innovative technologies to reduce the price of the costs. And it may be that I agree with what you're saying, Bob, in terms of we may shift our approach so that we use more of these research-based tests. But what we'd like to do is be able to innovate and bring these new tests into our CLIA lab so that we can drive innovation, bring it into our CLIA certified lab, and have these new technologies and have them medically certified so that we can get the results out immediately. That's what we're trying to get for. Bob will take us there, hopefully.
Well, that's perfect to talk about some of the, there are some things that were cost prohibitive. There are other methods that were used that don't really cost a thing. And we did get a question about the open Zoom link, the logistics of the open Zoom link. Brett, did you want to talk a little bit about that and how that helped with providing service while still social distancing?
Yeah, that was exactly it. There were some comments too about how we would iterate on the testing locations. Off the top of my head, I'm going to say that there was maybe 7 initially that we had for undergrads, 5 for grads, and then we had, combined, I think, 10 or 11 the final week. So, and we were iterating on where those locations would be. So in order to make sure that logistically we could support, each of those different locations, knowing that they may not be where they were yesterday, we thought that this was the best method to kind of distribute, and social distance in terms of the IT support. So it worked very well. We just kind of came up with the idea on the fly, and it allowed us to be in a lot of different places all at once.
Very nice. Thank you. Well, we only have a few more minutes left. So just as you've been embarking on this amazing journey to stand up these processes and this goal of return to learn, could you share what has been your biggest surprise so far? Or what advice would you have for anyone that has to also think about standing up a process like this? Either one of those, I would love to hear, and I'm sure our audience would love to hear too. Anyone want to take a stab at that? I know it's hard to think of one surprise. Maybe the whole thing was a surprise.
I'll start, and I think from a surprise standpoint, I wasn't really surprised. It's really hard to say that, but I really believe in how we've organized and developed skills across this university. And the only barrier I really saw was that we didn't know each other at the beginning and in the timeline. But you've got committed people at every university that want to try and reopen in the fall. If you give them this mission and vision of where you're trying to achieve, and have people that can really frame how you might get there, like Natasha, Chip, and Cheryl did for us, you maybe don't want to do it in 2 weeks. That would be a really good learning to take away. Don't try and do it in 2 weeks, but start with something small, see what you learn from it, and build, figure out how your culture can adapt some of this, and use that as you're kind of starting to be your guidepost. And of course, like Natasha said, we've been sharing everything we can. We're going to be putting out everything we've learned. So if anything we've done or can be a resource, we'll definitely share it.
I think one of the other things too is in the fact that we were in this remote situation, right? So we never met face to face, as Bob said, and we didn't know each other kind of prior to this. So self-assembling over Zoom to where everyone really is just kind of a Hollywood square box, kind of level set everyone in terms of, hey, we're all just contributors to this. Everyone understands kind of in this remote working environment, Zoom fatigue certainly can be an issue. But yet, utilizing all the technology and collaboration tools we had at our disposal kind of made things a lot easier, I would say. And that just kind of evolved too over time as we found out what worked and what didn't work. And as we did Zoom sessions on into the evening and late hours, we didn't have to worry about travel back and forth to locations and those kinds of things. So planning and being able to spark up something really quick amongst the team members, because we were all remote in the same situation, I think actually was an advantage to us in this situation.
We probably have time for one more person to respond about your biggest surprise or any advice out there for others that are going to be embarking on this kinds of effort.
So I guess I'll take that. I think my biggest surprise was actually in the end how easy the process was when we got through it. I mean, the 5 to 7 minutes, how streamlined we were able to do it. And I saw the sort of logistics as being the main challenge. But actually, the team was able to come together and work out something that worked very well. On the other side of it, I was incredibly surprised that the main motivating factor for participation was this community effort and not an individual effort. You heard that we tried a lot of different messaging in terms of we had voucher, people could win prizes if they participated. And those, messages just did not resonate with the students. They were so much more driven by this idea of collective community action. And that was a surprise to me. I didn't really understand what their motivations were, and it's going to be a huge taking point in terms of figuring out how to sort of take this program to scale in the fall.
Very nice. Thank you so much. And what a great panel today. I have to give everybody a round of applause. Woohoo!
Amazing. Thank you so much. Great. Tracy, take us out.
Excellent job, Ahren, on the facilitation of that. And I want to thank all of our panelists for a great session. I, along with many others, applaud you for taking on such a complicated and important problem. And what a great example of applying Lean Six Sigma and standing up a process for efficiency and effectiveness. It's very exciting. It's very inspiring. Thank you so much for joining us today. I hope all of our audience was able to also draw some inspiration and ideas as well if they also have to potentially look at this process. I know I learned a lot. So how about you? Everyone else, are you guys ready to get started with Lean Six Sigma if you haven't already? Well, if you're ready, we do have a great opportunity for you. Next Tuesday, we are no longer having the Palooza Tuesday series, but we are having an information session by UC San Diego Extension on their Lean Six Sigma Green Belt and Black Belt courses. And that is next Tuesday, June 16th from 9 to 10 a.m. And I will be hosting it. Yours truly. So if you are looking for exploring any training options, you don't want to miss next Tuesday as well. Put it on your calendar. And for the moment we've been waiting for, we are ready to be giving away a $500 voucher to be used towards a project management course or Lean Six Sigma Green Belt course, which you will learn about if you attend the information session next week. So the first person to answer this question in the chat window, the Q&A section wins the prize. So not only do you have to have the knowledge, you have to have the fast fingers to type in the section. And the question is, how many workflows were identified during the pilot phase? Let's see who wins that one. I'm gonna wait for Angela to let me know who the fast finger winner is on that one. So Ahren, did you enjoy this panel? Are you there, Ahren? Oh, you're
yeah, here I am. Oops,
okay.
I'm sorry. Here I am.
There you are. Sorry about that.
Oh, it was such an incredible panel. And Tracy, it is always so much fun working with you. I think you bring the sense of fun that we have here, and that's our culture with process improvement at UC San Diego. So thanks so much.
Thank you. Well, I really enjoyed participating in the Palooza Tuesday series, and I am really looking forward to being back in person too. So that's wonderful. So let's see, who is the winner? Let's see, do you see a winner on there yet?
I do. The winner is Cheryl Flynn.
All right, Cheryl.
Congratulations, Cheryl.
Congratulations, Cheryl. You'll be getting an email so you can spend your 500 buckaroos, your voucher. And I just, again, want to thank all of you for joining us today. For those of you who have joined us for the first time, or you've joined us every week, we've explored lots of ways to learn about continuous improvement and apply them in everyday operations. Wasn't that fun? And so, although we do have to say farewell and bring the 2020 Process Palooza Tuesday series to a close, rest assured there will always be more opportunities to apply Lean Six Sigma and stay connected. Be on the lookout for an email that will share a way to get involved and learn about process improvement. Farewell, everyone. Goodbye, and have a fabulous Tuesday.